All right. Good afternoon, everybody. We'll get all set up here. Today is the 14th of July, and we have special guest Kelly Dion is here from Bay Area Hospital. Always a good time when Kelly stops by. As always, Brian is here, and Barb. We always have Barb. Today, I'm just going to break some of your hearts. This is going to be our last town hall. We can't do this anymore. Not that we can't. We don't have. We have the obviously we have the technology to do it. We don't have the capacity to keep running the virtual town halls. We are pretty much maxed as a team, and we have to free up space to do other things because, as you know, if you've been paying attention, COVID-19 numbers keep climbing every day, not just locally, but in the state. We keep setting records on a daily basis for COVID cases. If you haven't got the memo yet, COVID-19 is actually a thing. Wear your mask. We would appreciate if you wore your mask. As you may notice, we are doing currently wearing of the masks. So I think, Brian, would you got a little update, a little speech you'd like to give? Win one for the Gipper kind of thing?
I could assume that anyone tuning in to our show is already kind of on board with the importance of COVID-19, and they already have concerns or questions enough to understand that this is something we really need to be mindful of. But that being said, we certainly are concerned with what we've seen in terms of the community mitigation directives that we've been given in terms of mask wearing, in terms of social distance, in terms of please trying to limit your travel. And so as evidenced by the case numbers rising that Eric has already mentioned, it's really becoming evident that there are a lot of myths out there about our situation that just aren't completely letting go. There are a lot of topics about mask wearing, about how masks aren't effective, or either that or freedom of choice, or things of that nature about, like, I don't want to wear a mask, I shouldn't have to. Regardless of what evidence your Facebook friend may try to demonstrate, there is a tremendous amount of evidence to show that community transmission of this illness really, really goes down when the community adoption of mask wearing and social distancing are really adhered to by the vast majority of the population. I don't think we necessarily need to get into the biology or the mechanics of that. I think that's kind of been argued into the ground. The evidence is there. Please help. Please do what you can. There are a lot of people in our community, your neighbors, your friends, your family that, are either vulnerable or are putting themselves in harm's way to be able to protect people, healthcare, first responders. Just please do what you can. Wearing a mask is not a tremendous burden. Staying and being mindful of social distance should not be a tremendous burden. It's not too much to ask.
It's really not. Wearing a mask to reduce the number, the COVID transmission is, and saying that that's not real is like saying that putting a diaper on a baby is not going to keep your floor dry.
Right.
It-
Right.
Kelly,
Quite an analogy.
well, sometimes just got to make it simple.
Yeah.
Do you have anything enlightening you'd like to share with us, Kelly?
About keeping your floors dry?
Or whatever.
No, just, on a personal note, I live with two people that are pretty significantly immunocompromised due to medications they take for a medical condition. And, I do most of the shopping and stuff outside the home, but I appreciate that people wear a mask. I think we kind of have a responsibility to protect the people in our community, the older people, the younger people, and the people that are sick.
I agree. I think that's absolutely for sure. And I think that there's, looking through the questions that Cynthia pulled off of our email, there's a couple that pertain to travel, right?
Mm-hmm.
And we've had this conversation, I think, a lot in the last few days
Mm-hmm.
regarding the fact that there aren't travel restrictions, right? So you hear all sorts of people like, man, I really saw a lot of license plates from
Mm-hmm.
pick a state in the vicinity, right? Yeah.
Yep.
What are they doing here? Well, there's no restriction to come here.
Right.
And people are like, well, gosh, I really hope they're taking precautions. And some of those people are the same people not taking precautions locally, right? So you take the precautions because you don't know who's in our area. You don't know who's at the store with you. You don't know who you are protecting or who is trying to protect you. Because if everybody says, I'm going to take care of myself, if I'm worried about taking care of me or doing my part, right, then you can be selfish about it.
Yeah.
I just want to take care of me. That's
right.
fine. If everybody was just maybe a little selfish in this and put a mask on, then we wouldn't have to really worry who's here from where if you're taking the proper precautions, because we can't stop those people.
Mm-hmm. Yep.
This is our last town hall. We've said the same thing over and over again. And that your point about if you're watching this, then you probably have, some understanding of the situation. I've found that just because somebody follows something doesn't mean that they follow it because they like it. I've found that out a lot on social media. Doesn't mean they are your friends.
Good point.
It's been a learning experience. Let's put it that way. You know what I didn't see? I didn't see any questions. Nope, never mind. Found one. Paige mentions that Shutter Creek outbreak has been resolved. How many cases did that outbreak represent?
Let's see. There were 25 adults in custody. There were 2 staff members that were confirmed. One staff member that was presumptive once that definition started being used. That was pretty late in the Shutter Creek outbreak cycle, and I believe that was it. So I believe that was 28, if my memory serves. But yeah, we haven't had a case since early May, and believe it or not, that's over 2 months ago.
Yeah. Really?
So yeah, my memory is, I guess I should have come prepared for Shutter Creek question anyway, but
right.
We're almost to the point that outbreak, which was responsible for the only case we had for months.
Yeah.
We're on the verge of that outbreak being less than half of our total cases now, based on what's happened in the last 10 days or so.
Right. You say that that's 2 months ago, and it feels like it was like last year.
Yeah. Yeah. Yep.
The public should have more information on the presumptive cases during the past 3 weeks. You are not giving the public information. So how do we know these are real cases? 8 presumptive cases. Quite frankly, from the information giving, I'm finding this hard to believe. Well, that's too bad. I am sorry.
I would challenge it. I mean, if that is the logic being used, I would say, well, then, how do you know they are confirmed cases? I mean, if you don't have the lab in front of you, how do you know?
Right. We can't make you necessarily believe what you want or not.
Right.
But so this brings up, just throwing most of that question away, the presumptive versus confirmed.
Right.
Why is one presumptive versus confirmed?
Mm-hmm. Good question. So I'm going to try to make this pretty clear now that they've added a second tier of a second option of presumptive cases. So a confirmed case is any case where someone has tested positive for COVID-19, what we call a lab confirmed case. And this type of test is called a nucleic acid amplification test. So they are looking at actual DNA or genetic material for the virus particle. Okay. Currently, that can include a lot of the rapid tests. That can include a lot of the tests that we send off. That includes the tests that are done at the state public health lab. Essentially, any of those tests that have been authorized with the emergency authorization system that the FDA uses, that is going to be a confirmed case. And that is regardless of whether the individual is showing symptoms, whether or not they have follow-up negative tests done. Once someone tests positive with one of those tests, that's the end of the story, even though other testing and other clinical evidence may kind of advise us on how serious the risk is and things like that of transmission. But that is the quick and dirty version of what is a confirmed case. Now, a presumptive case is there are 2 different ways that a presumptive case can be counted. Number 1 is if someone is a close contact, which are identified through our contact tracing processes. If someone is a close contact of a lab confirmed case, basically the definition we just went over, and they have symptoms, that, there are many symptoms that we're tracking for COVID-19, but the symptoms specifically in this case are technically 4 symptoms. One is cough, one is shortness of breath, one is fever or chills, and then one is a loss of taste or smell, whether partial or full. The 5th criteria is not really a symptom. It's radiographic evidence of viral pneumonia. So in other words, an interpretation of a chest X-ray is pretty much what we're looking at there. So if 2 of those 5 criteria are met and someone has been the close contact of a confirmed case in the previous 14 days, then regardless of whether they themselves are tested, and regardless of whether, if they were tested, they test negative, those individuals are presumptive cases. Now, the immediate obvious question at that point is, well, wait, even if they test negative, that doesn't make any sense to me. Well, one of the problems that's plagued our detection of COVID-19 for really since the beginning has been the reliability of negative test results with these PCR tests. There's a lot of different ways that, the timing of the test, when it is collected, when the specimen is collected in terms of along the range of illness, technique, there's a lot of things that could potentially go wrong. And that's why we say on average, there's about a 30% chance of a false negative. That kind of depends on the test, and it kind of, there are a lot of different platforms, but we know there's enough of a chance for a false negative that if someone has those symptoms of COVID-19 and we know they were in contact with someone that is confirmed with COVID-19, then we're basically kind of stating the obvious here and saying, well, then they probably have COVID-19, even if they happen to have gotten a negative test. The most recent addition to presumptive case status is there has been a, we've talked about antibody testing. We've had questions about that pop up off and on since, I don't know, March, maybe even earlier. But there is now a third test called antigen testing. And there is not much, there are not many healthcare providers in the area that are offering that right now. It's pretty new. And because it's pretty new, we are not using them for confirmed case status. A positive result from an antigen test is if we pair it up with either of those two categories we just mentioned, either close contact of a confirmed case in the last 14 days, or two of those 5 criteria, the 4 symptoms and the chest x-ray. So either of those two categories plus the positive antigen test, right now we are calling presumptive. That is not confirmed. That is presumptive. That I'm not 100% sure why that is. This is kind of a national case definition. But realistically, it's probably because it's so new, and they kind of want to have, they may want to have some time to validate those results and compare them to PCR results to make sure that there's not this huge testing? Right. Yeah. So that's kind of where we're at. I would say it's not in terms of how public health treats these two different categories, there is almost no difference. We treat a presumptive case just like a confirmed case in terms of case investigation, contact tracing, isolation recommendations, basically everything. The only difference between presumptive and confirmed right now is that it can't keep chaining along the line, where a presumptive case can give us more presumptive cases by contact with them plus the symptoms. That definition of within 14 days close contact, that is of a confirmed case. It's not of a confirmed or presumptive case.
All right.
So that was a lot. That was a lot. Hopefully that was understood.
I hope whoever asked that question wrote all that down. This is recorded, so you can go back and watch it, and then go back and watch it, and go back and watch it again, so that you can get all of that. It's just a lot. There's a lot going on with that stuff, and it is hard to keep up with.
For sure,
it's hard to keep up with, and we are the ones knee deep in it all the time.
Yeah.
There was a question, and I can handle this one.
Okay.
Says, can you please explain the report from 624 of 38 positives and 6 presumptives, and 625 of 34 and 34 positives and 5 presumptives? I can't explain that. It was a typo. Okay, so I have, that's basically the explanation. There was a math. There was a misshuffling of numbers. We do apologize for it. We were also slightly confused. Kelly, this one might be more in your wheelhouse. Question says, please let me and the rest of the public know if there is free testing for COVID-19 and where it is. Is anyone allowed to access testing? For instance, can people just walk into your department and obtain free testing for COVID-19? Also, can one obtain testing at their doctor's office or clinic? Do you know if Medicare and or Medicaid will pay for the test?
So I know as far as Bay Area Hospital goes, you would need an order from a physician to be tested. We're doing some testing on our elective cases. If you're scheduled for elective surgery, we test before you come in, kind of in an effort just to keep everybody safe. But we do have to have a doctor's order to run that test. So you would have to start with your primary care physician and come to us with an order.
And we don't we don't have you can't just come to the building and get a test here. There is, if you don't know, a hotline you can call, 541-266-1650. And I think press 1 and they'll ask you some questions, but it does make sense. Just start at your PCP and go from there. They should, if they feel like you need a test, whip you up an order, but we don't just have like drive up testing like some of the more metropolitan areas, just because it hasn't been something that we've been able to really put together or based. I mean, honestly, we haven't really needed to do one of those big widespread ones yet. So
and honestly, there are more rural communities that that have done that at times. It's really just a matter of, again, like Kelly was saying, the test does require a provider's order. So it's not just a decision by public health or not just a decision by the patient or anything like that. We do need to work with our medical providers in the area, and they are taking a lot into account. They're taking into account, where you've been, who you may have been exposed to, what your symptoms are, what's the context of your situation, in order to help get tested. We've heard some rumors that there may be a little bit of a tightening on testing components supply. We're not really sure of the details on that yet. We've just kind of been given a heads up that forecasting shows the possibility of a little bit more of a supply chain issue coming down the road potentially. So obviously supply is going to play a big part in that.
That's exciting.
Yeah.
Let's get into travel and visitors and things.
Mm-hmm.
Let's dive both feet into that, shall we? One person says, I am at high risk.
Mm-hmm.
Should visitors from California visit me this summer? I'm very nervous about this, but the visitors don't seem to be. Your views would be appreciated. I can say I've looked at the California numbers recently because I have family in Central California that wanted to try to gather for a momentous occasion, to which I was concerned about the numbers. So one, I would say if you've got someone who is at high risk, you really don't want to put yourself, I would imagine, at any more increased risk by bringing visitors from areas that have pretty significant numbers right now. And significant number of California counties have significant numbers.
Right. Yep. And I would add to that, I think what we saw when we started kind of opening up was, even before we started opening up, if we saw a certain maybe low level of travel that was happening regardless, travel that probably didn't fall under the governor's guidance and order. But once we started opening, it was like everybody was like, oh, okay, it must be safe. Let's go move. And that's kind of the problem with, hey, we're going to let people travel and we're going to remove travel restrictions, but we're asking you to still be, to use good judgment about what kind of travel is necessary and what kind of travel is not necessary. And while you're traveling, to be very cognizant of the same community mitigation measures that we've been harping on for a while: wash the hands, keep your distance, wear a mask. But there's that psychology, I think, of, well, if I can, that means I can, without asking, okay, just because I can, does that mean I should?
Right.
And when I can tell you that basically for the investigations that have happened for the last 10 days, for the ones that we feel really, really strong about how they came across the illness, almost every single one has been either travel outside the area or travel by friends, relatives coming here and then leaving a nice little present on their way out. So travel is a big thing.
Yep.
And
It's not to be said that it couldn't be done safely, and
right.
but the way you'd have to go about it is so like your plan has to be to get wherever it is you're going without really getting out of the car, except to get gas. Maybe you go to the bathroom, but you'd better have all of the
hand
sanitizers, doing everything you can. You get to a place that you're going, and then maybe just never leave is probably the safest way to go on vacation. So that you can just maybe not expose yourself to all. You're not going to go to Disneyland. I don't think Disneyland's open. I know Disney World is open. And they've got some mitigation measures and people are going.
Mm-hmm.
I mean, we don't have travel restrictions to say you can't leave Coos County and you can't come to Coos County.
Right.
Which kind of rolls into another question we had about there's some people planning a camping trip with friends.
Mm-hmm.
And 10 to 12 adults in separate RVs and tents. Made reservations several months ago. What restrictions should we be aware of regarding food prep, social distancing, etc., that might make us cancel our plans at this time? Also, are there any vehicle restrictions at this site? I didn't see much. I don't know anything about the vehicle restrictions. I don't know where they're going, but getting a bunch of people together from different households to go camping, you're outside, yes. So technically you could socially distance. Our campgrounds have been open since early March. March 11th, I think, is when they started opening the county ones. You can social distance, but how many you do any camping, Brian?
I have been camping, Eric.
Kelly, you do some camping?
We love to go camping.
So I could imagine that it might start off very successful. We're all social distancing. We're doing our thing. Then we're going to make some hot dogs and we're going to play a little cornhole. We're farther than 6 feet apart, so it's okay, right? Just disinfect the bags before you pick them up. But then maybe you start into the libations. And by the end of the night, you're hugging each other. And then the next morning, you're all having eggs around the same campfire, elbow to elbow. Human nature, it's hard to say, we're doing great. We're doing great. And then we're not doing great anymore.
Right.
That should, whether or not you cancel a camping trip, because, you might think you can do it.
Right.
Maybe you can do it. You just have to be mindful all of the time about what it is that you're trying to do. Mm-hmm. And that's hard.
Yep.
It's hard at work.
Yep.
It's hard at Walmart.
Mm-hmm. And you just look around, you see a lot of people not doing the things that public health has been asking them to do. And what's one more person?
Yeah.
Not doing it. I can relax my guard. Everybody else is, or at least a good chunk of people. That's kind of the psychology of the issue, I think, that we're dealing with.
I can tell you that this is not an effective way to work.
No, it is not, Eric.
Disneyland opens on the 17th. Thank you, Stephen. So if there's anybody interested in going to Disneyland, it opens on the 17th.
Just don't come back from Disneyland.
Yeah, stay in Disneyland.
Just find a place to rent. Stay there.
I bought a 3-day park hopper and got 14 days for free.
Yeah, exactly.
It's like the cruise ships. Oh gosh. It's good stuff. I think that camping in itself is not an off limits thing. You just have to be super mindful of it. It's like golf. Golf's never been taken off the board because most people can stay 6 feet away from each other. Yeah. But I can tell you, right, I'm usually playing on a completely different fairway. So I'm usually 6 feet away from anybody that was in my party anyway, because I've got to go way over there to find my golf ball. But it's when you get done golfing, like, how many people are like, well, we got to hit the 19th hole and have a drink before we leave. And you just kind of get comfortable. You don't think about it because you're having a good time doing all the other things. That's not anybody's fault. It's just what we do as humans. We want to be together to a degree. If you like people. Brian doesn't like people. I can see it in
Not
his
lately,
eyes.
man.
I can
It's
see it in his
probably
eyes.
a hazard of the job right now.
Yeah. Question on education. Are you educating people who are from Mexico on work visas? Mexican families seem to be at risk in Marion, Multnomah, and Washington counties. Goose needs to take preventative action to keep people safe. We do a fairly good job, I believe, at ensuring that our PSAs are also translated into Spanish so that the Hispanic community has access to the information that we are giving out. We try to find Spanish messaging that comes out of OHA to help share on social media. We have some Spanish translators for contact tracing, right? So we try in our capacity. Do you guys have that stuff at Bay Area Hospital, Kelly?
Our staff, information directed at our staff comes out printed only in English, but public facing things get translated.
Right. Yeah, well, yeah, I think we're the same way internally, but yeah, the external stuff, yeah. That might be an interesting question for both of you guys. This question says, we will have some essential workers leaving the area and returning after moving through currently identified hotspots within the U.S., or will have exposure to people from around the U.S. We would like to know if we can have them tested 2 times within a 2-week span while self-quarantining to decrease the likelihood of patient/community exposure here in Coos Bay. If that is possible, who would we contact to organize those tests? And also, what are standard guidelines to returning to the area after potentially being exposed or having family members visit from hotspot areas? I think we talked a little bit about the travel aspect of it, as far as that goes, but that poses an interesting question because this is not the first time that kind of question has come up. The people worried about either transferring from other areas or going somewhere and coming back. And then, like you said, those have brought some cases with them. So as a business person,
I think I'm kind of making an assumption here that when they're talking about essential workers, we're talking about healthcare workers or other similar responders that are going out to kind of support some of the communities that are having a pretty tough time and coming back.
That's how I felt the question was posed. Okay. So let's just answer it that way.
So then generally the employer for that individual coming back who they normally work at, it would certainly be the point of contact for, hey, let's make sure by a number of measures that it's safe for you to come back to work at our local facilities. Is that something that sounds correct, Kelly? I don't know if we have any Bay Area Hospital clinical staff doing something like that.
I'm not familiar with any individual cases of Bay Area staff doing that, but it has been discussed in our incident command, and we wouldn't necessarily test them just because they've been exposed. The same way we wouldn't test our own staff if they've been exposed. As long as there was appropriate PPE and the infection prevention protocols were all in place, there's not really a reason for us to test them unless they become symptomatic.
Right. Or or there was a concern about the specific situation where it's like, oh, maybe they didn't have all the correct gear on or something like that while they were there. Yeah. I think one of the questions that has kind of plagued us since the beginning has been this idea that a test is going to solve the issue, and that the idea that a test can be administered at any point along the way from exposure to resolution of symptoms. And that's just simply not the case. I mean, one of our clusters recently, we knew that she had been exposed. She hadn't had any symptoms. She tested negative. within 24 hours, she started developing symptoms. She got tested again the next day and she tested positive. So we've known for a long time that the severity of illness is pretty parallel with the likelihood of a true positive test if someone is infected.
Sure.
And so even though asymptomatic testing has uncovered some cases,
Right.
we're talking about the probability here that we're going to feel good about the results when tests are done at the asymptomatic stage.
Right. Like there's been a couple questions. We got one that says, why are we not testing the community for the silent spreaders? You could test 100 people, right? Asymptomatically. Maybe you get 3 positives and you feel good about those 3 positives, but you could miss 30 people because the very next day, like you said, then they would have been positive.
I mean, there is, part of the whole thing about why it's important that we do a really good job with case investigation and contact tracing is, we identify people that have been exposed, and then we have this open line of communication where, people say, hey, should I go get tested? And it's like, well, you were just exposed yesterday. Probably not a good idea. It's probably going to take a little bit longer for you to incubate. It's probably, going to be even better if we wait a couple of days to see if you start having symptoms. That way we feel a little bit better and more confident in the results. And those are people we know for a fact have been exposed to someone that is a confirmed lab confirmed COVID-19 case, much less just random areas. I know we've done some, significant asymptomatic testing, but there are certain settings where the likelihood of transmission is a lot stronger.
Right. And
so that kind of changes the statistical probability factor in that case.
Right.
And so, like the fishery group testing and
the fishing boats,
the Shutter Creek asymptomatic testing that was done.
Right. That's like examples. Like the food processing plants are places that you're in close contact with a bunch of people, and that's more. So that would be a more likely situation. Question is it possible to track the positive cases coming in the next several weeks due to the 4th of July activities? I'm guessing they would like to know if at some point down the road we can just parse out like this was the increase in numbers after the holiday. We didn't do that with Memorial Day weekend. We did see the numbers rise, and we just you make assumptions that they have something to do with that, and we've been worried about the holiday.
So part of the problem was, at least in May and maybe even the beginning of June, was there were a lot of cases that just kind of popped up that we did not have significant connections to as far as where they may have gotten sick. That so far has not necessarily been the case more recently. We've been able to trace cases back to certain exposures. And so maybe the question even more so about just the time correlation, but also maybe hey, can we, are we tracing this back to a backyard 4th of July barbecue or something like that specifically, not just the time, just not relative to the time of when the cases popped. So, so far there hasn't been any cases specifically tied to a 4th of July backyard party. But there definitely have been people talking about traveling for, the holiday weekend. And of course, that's always kind of a time where travel bumps up.
Sure.
And then as people are moving around more and more, your risk chance is going up.
I'm trying to, I was looking for our numbers. Hold on, because there's a question coming up here. Oh, here they are. See if I can get this out and make sense. Your explanations below the numbers include that. I'm guessing they're pointing it towards our SIT-STAT numbers. The Coos County Public Health Division now offers information on cases in the last 28 days. Does that apply to all the numbers provided, so that during the last 28 days you found 41 confirmed cases, but any identified before those last 28 days are not included?
No.
No.
So the description in the row with the number will
Right.
have an asterisk,
Like
or
tonight's
two
is
asterisks.
25.
So the definition, right? So the definition specifically, that definition specifically goes with the corresponding symbol,
Right.
in the row.
So if you were looking at the total cases in previous 28 days, has 2 asterisks next to it.
Right.
So you'd go down to where it has the 2. Serves 2 purposes. We feel this is better measure of reason. Oh, okay.
Yeah.
Well, the number is 25.
Yeah.
It's not 41. So the last 28 days, 25. Okay.
It's almost a case a day, Eric.
See, then you go and say stuff like that. I've been asked by people that I give reports to if I ever have any good news. I said, as soon as someone gives me some, I will give it to you. Would it be possible to report the number of people who are recovered from COVID-19 after being infected and the side effects without being hospitalized? The recovery, so let's split that up. The recovery numbers.
Okay. Talk about recovery numbers. Currently, we simply don't have a good way of pulling that report. I know that's something that has been reported in some counties. There are, one of the reasons why we brought up the cases the last 28 days was just to give individuals an idea of how many of the cases that you're seeing in the total are fairly recent. Some of the definitions that have been given out for recovered cases, like going forward and for a little while now, OHA has defined recovered as 60 days from your case started and not dead. That is not a very tangible thing for people to understand as far as recovered. That's not what people are thinking about when they see the word recovered, but then they see other places saying, oh, this is the number of recovered cases, and I think that means something significant, when obviously I think we can agree the criteria we just described is not significant. Glad to hear that somebody didn't die. Whether or not someone recovered after a couple of weeks, which is a lot more common, or 60 days, it usually does not take that long. That doesn't really communicate anything beneficial, I guess. And in fact, if we were to really kind of dive into when you see the word recovered, what does that mean to you? A lot of people haven't even gotten that far to think about what that might mean. But I think some are probably thinking it means who's not infectious anymore.
Right.
Right. Okay. So if someone is infectious, then they are at home. They are not exposing the rest of the community. And so then even that, I would question what the benefit of knowing how many people are currently, confirmed cases that are isolated. Well, I mean, why do you need to know that number if you're not going to go to their house and be exposed? So there is something that technically, yes, the ability is there. Do we have the capacity to spend that much time nailing that data down and putting it together? Right now, we're just trying to keep up with the cases, and no, we do not have time to do that.
Couple questions that in a roundabout way ask for us to give locations, not obviously addresses, but zip codes. And we've said on more than one occasion that OHA puts the numbers per zip code out in their weekly report, but that's not something that we are going to take the time to do. They can follow the OHA's COVID page and we read their weekly report. That will have the numbers nestled nicely in the body of that report.
Right. Empty?
0.
Zero viewers?
0 questions.
Okay.
In 0 viewers. No, it's 22 viewers
Okay.
watching right now. Hi, everybody. Let's see. Boop, 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 boop. One of the questions said today, I heard that Oregon, out of the 93 new cases, 24 on ventilators. What is the percentage in Coos County?
We currently have no ventilated patients.
So 0%.
Let me be a little bit more clear. We have no ventilated patients with a COVID diagnosis.
I feel like that's what they were looking for.
Yeah, probably.
So we'll say there are no percents. Well, we got about 15 more minutes. I've really enjoyed doing these. They've been fun, I think, in some cases. I like that we were able to get other people involved. I liked having. I liked it when we had our round tables. That was fun.
Yeah.
We drug Kelly in here every week to talk, or Steve to come in
Right.
and talk. That was nice.
For sure.
Now she gets to do it from her office, which seems like cheating, but
It is like cheating.
it's okay though. I would expect if things were to get super bad, we could maybe try at some point, but unless the manpower issue is resolved, we're not going to have the time to really do these. We do appreciate those people that hung out with us for the last few months. I guess we've been doing this. It's been a long time. And we were doing what every week at the beginning too. Oh my gosh. You've had to talk.
I just need to throw the phone away.
I don't. Yeah, I just
Every time I look at it,
put it in a safe somewhere, and then just walk away. That's
yeah,
what-
I mean, if we don't know, is there really a case?
if we stop testing. Well, I mean, it's not wrong. We start testing for the procedures, right? We had some tests. I mean, it's going to happen, right?
Yeah.
It happens.
Oh, sarcasm, by the way, if
Right.
that wasn't.
Jenna Donovan said, "Thanks,
Clear.
Barb."
Yes.
Barb has been able to say things we just have not been able to say. She's been amazing. She's been nice to have. She comes here every time we do one of these and hangs out with us and translates. I hope that it was helpful. She was awesome to have around. I will miss seeing her once a month. Oh, it's a disaster. It's a disaster that this health crisis has turned political. Yep. I don't disagree with you. So I think we just have to keep telling everybody, and I hope that we can get through at some point to everybody that we need to keep maintaining the things that we've been pressing from the beginning, the preventative measures to try to keep this at the lowest number that we can. And if we want to try to reverse our trend, we need to be working together to do those things, right?
Mm-hmm.
Washing our hands, not touching our face.
And I guess one thing that I could add, we unfortunately we've had to see a lot of there's been a lot of funny videos or some not so funny videos on social media about people getting into confrontations about masks, and I'm certainly not asking anybody to get into a confrontation with somebody that's not wearing a mask whatsoever. Please do not. But there is something to be said for the peer pressure factor if you have friends, if you have relatives, if you have loved ones, and you just come from perhaps different ideological spectrums, and don't be afraid to just, simply say, hey, I appreciate if you're going to come over to my house.
Right.
I'd like you to wear a mask if we're going to go hang out at wherever. I want you to wear a mask. I know you don't feel like wearing a mask, but this is the price of hanging out with me, or the price of, going places with me. I want to see that mask. There are other places that you go to where they will look at you funny if you're not wearing a mask. Like, everybody is on board, and they're slowing the spread of illness. And I think the comment about the fact that it's become politicized is true, and it's unfortunate. I don't know whether the virus is a conservative or a liberal, but the virus is not caring who it infects.
Well, we mentioned a long time ago, and we tried to press this, that it's non-discriminatory, right? It doesn't care who you are. It doesn't care what you look like. It doesn't care what your religious beliefs are, or your political beliefs. The virus is going to do what a virus does. And it's up to us to try to mitigate the damage that the virus can cause in our local area. And we are a small area. It's really not hard if it wanted to, and people didn't want to take it seriously, for it to spread fairly quickly and significantly in our area. And I think for the most part, our community is doing a pretty good job. There's always outliers. There's always, I would say that there's been times where I'd gotten out of my car and went, oh, my mask, and I got to go back.
Sure. Yep, me too.
Or I've had to go home to get my mask because I didn't have it. But it's new. I mean, relatively, right? The whole process. Yep. We never really even got to get into the, like, remembering to take your bag into the store before COVID happened. We never even got to really get used to that. And then it turned into a mask thing. So we have to just change gears, but I think we can do it. We need to realize that it's for the benefit of everybody. Ultimately, just because it hasn't affected you personally doesn't mean that it's not a thing you should worry about.
Yep.
Get off my soapbox. But it is what it is. We're going to continue to do what we do. Our team is going to continue to do what it does to try to keep things going in the right direction, working with people like Kelly and Bay Area Hospital and Northern Medical Center and all the various healthcare providers in the area and first responders to try to ensure the safety of our community and every one of its members, regardless of whether or not they like what we're doing.
Yes. Yes, that was very important to remember.
I have an anecdotal story about mask or no mask.
Yeah.
So I was running around like a crazy person, which is kind of a weekend pastime, trying to get everything done during the weekend. And I had to go into a local pet store, and I had left my mask hanging from my visor. Have you ever been to like a social event where you walk in and you're like, oh my goodness, I am so underdressed for this? So that was like that feeling I had when I walked in and everybody looked at me. And I was like, oh, I'm a loser. I had to go back out to my truck and get my mask because I just felt almost like going to school naked, right? Like, I am so underdressed, unprepared for this. So there's my weekend.
That reminds me of those restaurants that say you have to have a jacket. You know, sorry, sir, you can't come in here with a jacket. So they get something out of the box that like smells like the Goodwill, and you're kind of like, oh no, I should have worn my jacket, because now they've given me somebody else's jacket that doesn't fit me. I look silly. But you're right, that whole social pressure that oh man, I don't fit in. Maybe a couple times of feeling uncomfortable, you're like, I'm just going to make sure I have it, because you do. You kind of feel dumb. I mean, if you're running, you're like, ah, you're gonna turn around and go back.
Yeah, only took that once. I'm converted.
Yeah, way to go, Kelly. You've gotten a whole arrangement of masks now, and I really like the style you're bringing with your your face gear.
Hey man, yeah, let's make it a fashion statement. You know,
It is. It is. I mean, it can be.
Yeah.
It's just another thing. It's like a tie.
Yeah.
I have my Sun Devils one, and then I've got some Navy ones at home.
Now, while no one cares about the Sun Devils, we are caring that you are masked up.
I don't think that that's true. Some people care. My wife bought some purple ones, like from the bed maker purple.
Oh, jeez. Is it made of?
It's super soft.
Foam.
Oh my gosh. The earpieces they're of the stuff that's inside. It's really really soft. Cool. They're really neat. No nose thing. So my glasses, I look like a morning windshield when you turn the heater on. Can't see anything. But wearing a mask is kind of like wearing shoes or a hat, etc. No, that's true. That's a very good point. It's an accessory, I guess. Like you can make it however you want it. I mean, people love their shoes. They love their hats. If you really get into it, and more companies out there are putting some really cool. Cynthia has a Galaxy mask on.
Yep.
That's out of this world.
But
thanks, folks. Tip your wait staff. But no, it's true. I think if we get our minds wrapped around things like that, and we get used to it, really is what it comes down to getting used to the fact that you've got something on your face all the time. Then I think we can make it. We just have to get there. Baby steps, folks. Yeah, Kelly agrees. Anybody have anything insightful before we go? Before we wrap up this final virtual town hall?
Probably final.
Maybe.
Most likely final.
Highly likely it's our final one. No, Kelly doesn't have anything. You don't have anything brilliant?
I've been introduced by a few people recently as the very tired looking Brian, and so I'm starting to get a little bit of a yeah, what's the word?
A complex?
Complex. Yeah, I'm starting to get a little bit of a complex. So, hopefully I haven't been too dislikable, but even if you don't want to wear a mask, just think of how many hours that our investigative team is putting out, and yeah,
just think about how dislikable Brian is.
Please,
and then
please help me. Please help.
Brian,
you guys have done.
I will forever introduce you as a virologist.
I'm going to start introducing him as the Radiant Brian. Your team has done so much work to try to track all of these things down and do all of the things that need to be done in this. It's insane, and really no rest and since early February.
Yeah,
it has definitely been a strain on you guys, and we appreciate all that you're doing, and hopefully you can get some rest in this next week.
Yes.
You're gonna not answer any phone.
Oh yeah, I got a few days planned.
That's right.
Yes.
I don't want to see your name on my phone.
We are gonna take preventative measures. Yes.
That's a good idea. All right. So thank you, everybody. We hope to not have to do this anymore, but if we do, we will send out PSAs to let everybody know.
And nothing says you can't throw questions at COVID.
You are always welcome to email us at covid19.questions@chw.coos.or.us. Cynthia would be delighted to see your questions so that she can get them to the appropriate person. Always check our Facebook page. Always lots of fun going on there. And our Coos Health and Wellness website is our COVID-19 page. Has a lot of information. There's the COVID hotline over 266-1650. Kelly's always at Bay Area Hospital if you need anything. She's right now, actually. So until next time, everybody, stay safe. Please wear your mask. and take the proper precautions. We don't want to have to contact trace for you. So we will hopefully see everybody healthy on the other side of this whole thing. So, all right, everybody. Good night.